Today we are back with our friends here at South Texas Brain and Spine Center. The doctor is in the house and we're visiting with Dr. Alexander, talking about something that's happened to all of us, which is a fall or some kind of a fracture or something. If you have that continuous pain afterwards or even after you've been treated, what are some treatments that we could be looking at? So first of all, what are some of the most common fractures or problems that you see with the spine related to this?
So essentially when you get older, and especially in women and age, you get osteoporosis. Your bones become more softer. So a small fall can cause it to fracture and can cause intense pain. So these are typically, we get x-rays if you go to the ER, and there's treatment options that are not that invasive. Usually we do an outpatient, and we're basically a procedure called kyphoplasty, where we will put a small probe into the fracture under x-ray guidance, and we have a balloon that opens up the fracture, and we put some cement in, and this bone cement hardens within a couple of minutes. It's called kyphoplasty, and it's actually worked really well on most of the patients. Again, it's not going to be 100% pain-free, but typically 80-90%, and then some will take time to get better.
Very interesting.
But we have patients who are bedbound, they can't even move or turn, and that incredible pain, and they feel much improved. And it's not very invasive. It's under a small needle. It's not it's outpatient, go home the same day.
Wow, impressive. And yes, very minimally invasive. If those are the only two scars, I mean, that's better than a lot of other surgeries that we might have that are a lot more common. So who's a good candidate for this type of procedure?
So it's more common in elderly people. Younger people, their bones are not as porous or soft, and they might need any type of, again, not every patient can have kyphoplasty. Patients are, I want this procedure. No, it doesn't work that way, right? So if the patient has any type of stenosis or compression of the nerve or weakness or numbness, then they wouldn't be a candidate for this. So patients who have kind of axial back pain, and typically we get an MRI scan to see if the fracture is new or old and how severe or any neurological compression of the elements. Okay,
and of course I always have to ask, is there any natural remedy or something we can do to prevent osteoporosis or anything that would lead us in the direction of needing this type of procedure? One thing
I do believe is really aggressive treatment of osteoporosis, which is really not as treated as it should be. So even if you take a bunch of milk and calcium, it doesn't mean that the calcium goes into the bone. So sometimes you need hormones to help to promote the calcium to go into your bones to make your bones strong. So if you have a femur fracture, your chance of mortality rate is about 25%.
Really?
So that's why in elderly people, it's really important to treat osteoporosis to prevent fractures.
And what does that treatment look like?
It all depends on what the problem is. Is it a calcium problem, vitamin D? Does it need injection? So it all depends on the patient and the degree. So you get a bone density test, and it's an exam that tells you your degree of osteoporosis.
Awesome. And is that something that we can request on our own, or do we have to come in with some sort of symptoms that lead to an alarming sign for osteoporosis?
Typically, your primary care doctor should, when you reach a certain age, order a bone density test to see where you're at.
Good.
If you're taking other medications like steroids, that increases the risk for osteoporosis. If you drink a lot of alcohol, that increases risk for osteoporosis. If you have a thyroid problem, there's certain conditions that can increase the risk of having osteoporosis and subsequently a fracture.
Very, very interesting.
So fracture prevention is more important.
Absolutely.
Probably better than to have surgery if you can.
Yes, and that leads into your physical health and making sure that you're taking care of yourself and staying limber, flexible, lifting, and doing all those things appropriately. So we're really grateful for this partnership. We've gotten so much useful information with Doctor in the House. We couldn't be more grateful to have them here. If you or someone you know is looking for treatment on anything having to do with the brain and spine, certainly reach out for more information, and don't forget to let them know Coastal Living sent you. Thank you so much.
Thank you.
Coastal Living's Doctor in the House is paid for